Want to score over 850 in your HESI fundamentals exam? Then let's get started. Today we're covering 10 questions on safety and mobility. The best way to pass your HESIs is by practicing questions and applying your knowledge. Question 1. A patient with limited mobility due to a recent surgery is at risk for pressure ulcers. Which intervention is most appropriate for preventing pressure ulcers? Reposition the patient every 4 hours. Encourage the patient to sit in a chair for extended periods. Use a donut shaped cushion under the patient's buttocks. Apply lotion to the skin and keep it moisturized. Pause the video and select your answer. The correct answer is A. Reposition the patient every 4 hours. Repositioning the patient every 4 hours helps alleviate pressure on bony prominences, reducing the risk of pressure ulcers. You can pause the video and go through why the other options were incorrect. Question 2. When transferring a patient from the bed to a wheelchair, which action is essential for preventing injury? Using a gait belt for assistance, asking the patient to stand up quickly, allowing the patient to hold onto the IV pole, transferring the patient without assistance. Pause the video and select your answer. The correct answer is A, using a gait belt for assistance. Using a gait belt provides stability and support during transfers, reducing the risk of injury to both the patient and the caregiver. Question 3. Which action by the nurse is most important for preventing falls in an elderly patient? Ensuring the patient's room is dimly lit during the night, encouraging the use of assistive devices such as canes or walkers, administering sedatives to promote sleep at night, providing high sided beds to prevent rolling out. Pause the video and select your answer. The correct answer is B, encouraging the use of assistive devices such as canes or walkers. Assistive devices such as canes or walkers provide support and stability, reducing the risk of falls in the elderly patients. Question 4. Which intervention is essential for preventing aspiration in a patient with dysphagia? Encouraging the patient to eat quickly to minimize swallowing difficulty, positioning the patient upright at a 90-degree angle during meals, offering thin liquids to facilitate swallowing, administering medications via nasogastric tube. Pause the video and select your answer. The correct answer is B, positioning the patient upright at a 90-degree angle during meals. Positioning the patient upright at a 90-degree angle helps prevent aspiration by facilitating swallowing and minimizing the risk of food or liquids entering the airway. Question 5. What is the priority action for a nurse when caring for a patient with a seizure disorder? Ensuring the patient is in supine position during the seizure, placing padded tongue blades in the patient's mouth during the seizure, restraining the patient's limbs to prevent injury during a seizure, administering anti seizure medications as prescribed. Pause the video and select your answer. The correct answer is D, administering anti seizure medications as prescribed. Administering anti seizure medication as prescribed help control seizure activity and prevent further episodes. Okay, guys, we're halfway there. Let's keep going. Question 6. Which intervention is most appropriate for preventing patient falls in a hospital setting? Keeping the bed in the highest position with the side rails up, encouraging the patient to ambulate independently, using bed alarms to alert staff when the patient tries to get out of bed, allowing visitors to stay in the patient room at all times. Pause the video and select your answer. The correct answer is C, using bed alarms to alert staff when the patient tries to get out of bed. Bed alarms help notify staff when a patient attempts to leave the bed, allowing for timely assistance and fall prevention measures. Question 7. Which action by the nurse is most appropriate when assisting a patient with mobility after hip replacement surgery? Encouraging the patient to perform high impact exercises, allowing the patient to bear weight on the affected hip immediately, using assistive devices such as a walker or crutches for support, limiting the patient's mobility to bed rest for the first 24 hours. Pause the video and select your answer. The correct answer is C, using assistive devices such as a walker or crutches for support. Using assistive devices such as a walker or crutches helps provide support and stability, facilitating safety mobility and reducing the risk of falls or injury after hip replacement surgery. Question 8. What is a priority intervention for a patient experiencing a seizure? Restraining the patient's limbs to prevent injury, placing a tongue depressor in the patient's mouth to prevent tongue biting, moving nearby objects to prevent injury, administering anti seizure medication immediately. Pause the video and select your answer. The correct answer is C, moving nearby objects to prevent injury. Moving nearby objects helps prevent injury to the patient during a seizure by creating a safe environment free of potential hazards. Question 9. What is the priority action for a nurse when caring for a patient with Parkinson's disease? Encouraging independence in activities of daily living, administering medications on time to manage symptoms, limiting physical activity to prevent fatigue, using restraints to prevent injury during episodes of dyskinesia. Pause the video and select your answer. The correct answer is B, administering medications on time to manage symptoms. Administering medications on time is crucial for managing symptoms such as tremors and rigidity in patients with Parkinson's disease and promoting their comfort and function. Woohoo! Okay, guys, you made it to question 10. Which action by the nurse is most appropriate when caring for a patient with a history of falls? Keeping the bed in the highest position with side rails up, allowing the patient to walk to the bathroom unassisted, placing the patient in a room near the nurse's station, using a bed alarm to alert staff when the patient tries to get out of bed. Pause the video and select your answer. The correct answer is D, using a bed alarm to alert staff when the patient tries to get out of bed. Using a bed alarm helps notify staff when a patient attempts to leave the bed, allowing for timely assistance and fall prevention measures in patients with a history of falls. Congratulations, guys! You just finished 10 questions. You are one step closer to scoring over 850 in your HESI Fundamentals exam. Click that subscribe button and join us next Friday.